Picture it. You're out at dinner, laughing with your friends. And then, one of them goes completely silent. Their eyes are wide with panic. They can't speak. They can't breathe. And in those seconds, which feel like an eternity, what you do next, well, it could be the difference between life and death.
Choking is exactly that, a silent, terrifying emergency. In the blink of an eye, a good meal turns into a nightmare. And here's the scary part. Your first instinct, that thing you think you're supposed to do, it could actually be a fatal mistake. But there's a secret. There's one simple question, just one, that cuts through all the panic. And the answer to that question tells you exactly what to do. Stick with me because by the end of this, you're going to know that question and you're going to know how to save a life. Let's get into it. Okay, before you jump in and try to be a hero, you have to stop for just 1 second. You have to assess what's happening. Everything we're about to talk about hinges on the answer to this one critical question. Here it is, the golden rule. If you see someone choking and they're coughing loudly, making a lot of noise, that's actually a good sign. It means their airway is only partially blocked and their body is already fighting to clear it. Your job is to just encourage them. Keep coughing. But if they're silent, if they're just gasping with no sound coming out, that's a total blockage. That's your cue to act, and act now. All right, so the person is silent. Total blockage. For any adult or child over the age of 1, we turn to the classic life-saving technique, the Heimlich maneuver. Let's break down exactly how you do this, step by step. Okay, here's what you do. You get right behind them, wrap your arms around their waist. Now, make a fist with one hand. This is important. Put the thumb side of your fist against their stomach, right above the belly button, but below the rib cage. Now, grab that fist with your other hand and give a quick, sharp thrust, both inward and upward, like you're trying to scoop them up. You keep doing that hard and fast until whatever is stuck in there flies out. And this diagram, it shows you exactly what I'm talking about. See that hand placement right in that sweet spot? And those arrows show the motion perfectly, in and up. You're basically using the air trapped in their lungs as a piston to launch that blockage right out of their airway. It's incredibly powerful when you do it right. Now listen up because this is super important. This isn't a one-size-fits-all solution. If the person is pregnant or if you just can't get your arms around their waist, you don't do abdominal thrusts. You switch to chest thrusts. You bring your hands up higher to the center of their chest on the breastbone, and you thrust straight back. Same idea, totally different, and very critical location. It is a horrifying thought, isn't it? Being all alone when it happens. You take a bite of food, it goes down the wrong way, and silence. No one is there to help you. What on earth do you do? Well, you can actually save yourself. Don't panic. You're going to find a sturdy object. Fast. A countertop, the back of a solid chair, anything. You're going to use that object to give yourself a Heimlich. Lean over it, positioning the edge right into your upper abdomen, that same spot we talked about. Then use your own body weight and slam yourself down hard. You're using the edge of that chair to create the same upward force. Okay, you now have the knowledge to save an adult and even yourself. But what we're about to cover next, it's a completely different ballgame. You never use these techniques on a baby. Doing so could cause serious, serious harm. The next 90 seconds are probably the most important in this entire explainer, so please stay with us. When we're talking about an infant, anyone under the age of 1, you have to forget everything about the Heimlich. Their bodies are just too fragile. Instead, we use a very specific technique called the 5 and 5 method. It's a rhythm. First, you'll lay the baby face down along your forearm, using your leg for support, and you'll give 5 firm, solid back blows right between their tiny shoulder blades. If that doesn't clear it, you carefully flip the baby over onto your other arm, and you give 5 chest thrusts using just 2 fingers in the center of their chest. And you just keep repeating that cycle. 5 back blows, then 5 chest thrusts. Take a really good look at this picture. The positioning here is absolutely vital. You see how the baby's head is supported, but it's also lower than their chest? That's so important. You're letting gravity become your assistant here, helping to pull that object out. This isn't just random slapping. It's a very precise, very safe, and very effective procedure. All right, now we have to talk about the things that people get wrong. Because in a moment of sheer panic, it's easy to fall back on instincts or things you think you've heard. And some of those instincts are flat out dangerous. Let's tackle these myths head on. This is probably the number one thing people do. Someone's choking, and you run to get them a glass of water, right? To help wash it down. It seems logical. The answer? No. Absolutely 100% never do this. I mean, think about it. The road is blocked, the water has nowhere to go, so it's just going to fill up their mouth and throat, and it might even go down into their lungs. That's called aspiration, and it can cause a whole new set of problems. You're not helping, you're just making a terrifying situation even worse. Okay, here's the other big one. That instinct to just stick your finger down their throat and try to fish the object out. Just get in there and grab it. Seems proactive, right? And once again, the answer is a hard no. Do not ever do a blind finger sweep. You're basically sticking your finger into a dark tunnel, hoping to find something. What's far more likely is that you're just going to push that object even deeper. You could turn a partial blockage where they were still getting some air into a complete blockage. The only time your finger goes in their mouth is if you can literally see the object and know you can easily pull it out. Otherwise, hands off. Okay, you did it. The technique worked, the object is out, the person is breathing again. Everyone lets out a huge sigh of relief. The danger is over, right? Well, not quite. Your job is not done. There is one more absolutely mandatory step, and this is completely non-negotiable. Anyone who has received abdominal or chest thrusts needs to go to the emergency room for a checkup. Period. Look, the force needed to save a life can sometimes cause internal bruising or even damage to ribs. It has to be checked out by a professional. Always. So, let's circle all the way back to the beginning. That one simple question that changes everything, it's simply, can you cough? If the answer is yes, if they are making noise, you encourage them. If the answer is no, if they are silent, you act. That simple question is the key that unlocks everything we've talked about today. We sincerely hope you never, ever have to use this information, but now you're prepared. What did you think of this explainer? Please let us know down in the comments. We really do read and reply to every single one. Because being prepared isn't a one-time thing, it's a commitment. To continue learning more life-saving skills, go ahead and scan the code on your screen to visit us at King's Academy. Thank you for your time. Stay safe and stay ready.